The blood vessel that brings blood to the right atrium is inferior vena cava, coronary artery, aorta, pulmonary artery. Answer: inferior vena cava. Next question. Which of the following conditions is caused by elevated intraocular pressure? Glaucoma, cataract, strabismus, myopia. Answer: glaucoma. Next question. Which of the following is the most common pathogenic finding in individuals at risk for sudden cardiac death? Aortic valve disease, mitral valve disease, left ventricular dysfunction, atherosclerotic heart disease. Answer: atherosclerotic heart disease. Next question. Which of the following is an absolute contraindication for the use of fibrinolytic therapy? Use of anticoagulant, liver disease, suspected aortic dissection, peptic ulcer disease. Answer: suspected aortic dissection. Next question. Which of the following drugs provide relief of anxiety and decreases both preload and afterload? Acetylcholine, morphine sulfate, furosemide, dobutamine. Answer: morphine sulfate. In a normal sinus rhythm, the measurement of an ST segment is 0.06 second, 0.08 second, 0.12 second, 0.34 second. Answer: 0.12 second. Next question. Which of the following is an intervention for a patient with chronic obstructive pulmonary disorder? Pursed lip breathing, chronic steroid therapy, high flow oxygen, high carbohydrate diet. Answer: pursed lip breathing. Next question. Which of the following is a normal finding obtained during a lymph node? Hard fixed node, firm mobile node, enlarged tender node, hard non tender node. Answer: firm mobile node. Next question. What is the usual treatment of Raynaud's phenomenon? Calcium channel blockers, amputation, atrial bypass surgery, smoking cessation. Answer: calcium channel blockers. Next question. A patient is admitted with the diagnosis of diarrhea with dehydration. What could be the cause of increased peristalsis? Sympathetic inhibition, mixing a propulsion, sympathetic stimulation, parasympathetic stimulation. Answer: parasympathetic stimulation. Next question. The most common pathogenic mechanism of acute pancreatitis is lack of enzyme secretion, overproduction of enzymes, bacterial infection, autodigestion of the pancreas. Answer: autodigestion of the pancreas. Next question. What does the nurse monitor for in a patient with acute renal failure? Hypernatremia with CNS depression, pulmonary edema and ECG changes, Kussmaul respiration and hypotension, urine with high specific gravity. Answer: pulmonary edema and ECG changes. Next question. A disease caused by Trypanosoma pallidum is scabies, syphilis, hepatitis A, leprosy. Answer: syphilis. Next question. Which of the following is an important nursing interventions for a patient with Cushing syndrome? Restrict protein intake, observe for hypertension, protect from infection, restrict carbohydrate intake. Answer: protect from infection. Involvement of which of the following structures will lead to right-sided hemiplegia and aphasia? Left middle cerebral artery, vertebral artery, brainstem, right middle cerebral artery. Answer: left middle cerebral artery. Next question. Which one of the following is a common response expected in a patient with stroke to the change in body image? Daniel, disassociation, delusion, depression. Answer: depression. Next question. A patient with early osteoporosis must be advised to lose weight, start exercise, eat high protein, stop smoking. Answer: stop smoking. Next question. For doing nasotracheal suctioning, during which of the following patient activities the catheter should be inserted? Swallowing, inhaling, exhaling, retching. Answer: inhaling. The simple most effective method for reducing the risk of stasis of pulmonary secretions is antibiotics, chest physiotherapy, 2-hourly position change, oxygen administration. Answer: 2-hourly position change.